And it can be a filter for you as well. If you are curious about this, but not sure where you're going to fit in, it is perfectly okay to listen. In fact, 80% of the online audience is just listening. Only 20% actually contribute content to the internet. If 80% of people in this room decide today they're just going to get a Twitter account and use it to listen to the online conversation, that is perfectly okay, it's perfectly natural. It's actually what most people are doing. They are lurking. They are going to blogs like 33 Charts, he happens to be a gastroenterologist in Texas, who I follow on Twitter, and I follow his blog. And he writes quite a bit about this intersection of healthcare and social media. He has some great advice, actually, for how to enter into this in an easy way, in a low-risk way. He has written about how if you're not sure that you really want to get into Twitter, start with LinkedIn. LinkedIn is kind of the shallow end of the pool. And you can wade in from there in terms of how you want to have basically an online reputation that matches your offline reputation, as Zach talked about, which I also think is really important. And LinkedIn allows you to use your real name and have everything that you care about displayed online. In terms of sharing, I think that if just lurking and listening online is the shallow end, you'll be wading a little bit into deeper waters if you start to share. If you go to a blog and you think it's useful, you email it to a friend, you leave a comment, maybe you tweet a link to it. And that, again, is something that you can do that is sort of, again, low risk. You're just sharing something that you're reading, but acting as a filter for your audience and for your friends and your colleagues. And actually, what Brian, the blogger that I highlighted before, what he's talked about, when I asked for advice on my blog, epatients.net, I asked for advice about, this is going to be the first time that I'm talking to a group of surgeons. What should I talk about? And his advice actually is, this is not coming from me, I should quickly say, he believes that physicians have an obligation to share. That would be one of the focusing questions that I would love to hear from you about if there's time for Q&A or later on Twitter or elsewhere. Do physicians have an obligation to share? Do you have an obligation to contribute what you know to, and his example was actually the autism and vaccination debate, that there was a lack of science, as he says, in this debate. And anytime you see a lack of science in a discussion that involves your specialty, do you have an obligation to share? The last point is create. Now this is the deep end of the pool. And again, this is very much the top of the pyramid for people. But it's something to think about. It's something to think about in terms of what you want to do online. And whether it's going to be using Twitter, whether it's going to be using a blog, whether it's going to be putting up videos on YouTube, whatever it is that you decide to do, when you create content for the internet, you're participating in the online conversation. And I guess the other focusing question that I would ask is what's your goal? I think that's going to be the central question for anybody before they enter into this. Do you want to participate in an open system like Twitter? Do you want to have a public blog? Do you want to have create a page on Facebook for yourself? Do you want it to be an open system? Is this essentially about marketing? Is it about your online reputation? Or do you want to participate in a closed system like Sermo? Do you want to protect your tweets so that only people you know can see them? Is this really just about a closed loop of continuing education? So these are some of the questions that consumers face, and these are some of the trends that I'm seeing in terms of consumers that I thought would be useful to talk about here today. in the end, what I think we're talking about in general is a new model of participatory medicine. Patients are learning from each other. Patients are learning from health professionals. Health professionals are learning from each other. But the question is, what can health professionals learn from patients? Thank you very much.
I'll answer her question first. It's even at the Q&A, but yes, I think we all need to share. And I think that'll be a good opening question for the Q&A. Our last speaker is a person who I think we all want to hear from. This is Rebecca Monson. She is a partner in the law firm of Pepper Hamilton in Philadelphia, and her practice is devoted to online social networking, along with a lot of other medical topics. She wanted me to emphasize that she's a good lawyer, not a bad lawyer. And from all my interactions with her, I would agree. I think she will hopefully quell some of the fears that some of us might have by, as Susanna said, stepping into the shallow water and then swimming in the deep water. Rebecca.
Thank you. Good afternoon. Just to add on to what Dr. Glick said, yes, I practice in our healthcare services group, representing a lot of healthcare providers, physicians, doing regulatory and other business structuring work. And I devote a fair amount of time to HIPAA and privacy issues. And as you see here, I have nothing in particular to disclose. So I wanted to talk today, and one of my main points is ultimately going to be balance. This is a pretty well-known cartoon that many of you may have seen. It ran in a number of publications over the years. But I think it highlights 2 points. The first one being accessibility. Anyone can get on the web, anyone can put information out there. But then also highlighting the risk that goes with that. And as a reader and a viewer, you may not necessarily know enough about the person who put that information out there, and is it therefore reliable? We've been talking about a lot of the benefits to social networking, and there are many, and I've listed some of them here: transparency, education, improving patient care, and so on. And along with that, there are risks and challenges to managing information and your own dialogue online. I'm going to go through some of these today. Patient privacy being the top of the list, and then various liability exposures related also to physician-patient relationships and establishing them. The ethical issue I'll touch on very briefly on blurring your professional and personal lives, misinformation, and then I've listed speed and reach on both a benefit and a risk and challenge, because I see it in both places. On the one hand, you can reach the hundreds, thousands, from our discussions on Twitter, you can reach anyone who wants to hear from you, but at the same time, if there's an error, if something goes out erroneously, it's not really you, someone hacks into an account and so forth, that same speed and reach can become a risk. So the top of the list, of course, is patient privacy. Protection of patient privacy and complying with federal and state laws on privacy is an issue when delving into social media. We're all quite familiar, I would assume, about HIPAA and privacy requirements that go with that. But just in brief, HIPAA regulates when PHI or protected health information may be used or disclosed by physicians and other covered entities, and requires the safeguards that go along with that for protecting patient information. With the passage of the stimulus bill over a year ago and the High-Tech Act that was included within that, new and more stringent requirements on protecting PHI and enhanced penalties were included. Some of you may be following the developments of HIPAA, but there were proposed new regulations that came out over the summer. HHS is collecting comments and reviewing them right now, and there will final new and improved HIPAA privacy rule at some point, maybe later this year. I don't actually have inside information on that. So, but coming up, there will be changes in the HIPAA privacy rules. A big add to that was the breach notification requirements, which require individuals whose unsecured PHI has been breached, notification be sent out to them. It's important to note here that PHI does not include truly de-identified information, and there is a safe harbor under the HIPAA rules where a list of 18 identifiers, if they're not included, information is considered truly de-identified. And I'll talk about that more in a moment, about whether information is truly de-identified or not. In addition to the federal privacy laws, we have a myriad of state privacy laws. Most states now have their own breach notification laws, as well as various health medical records laws, and in some cases their own patient privacy laws. And you combine that with a variety of privacy torts that patients can turn to if they choose to litigate against individual employees or employers for breaches of confidentiality. There is little, if any, case law on this in social media yet, but it's been used before in other similar and somewhat analogous situations. There have been cases brought against providers when medical photos were used in physician advertising without proper consent. There was a case about a documentary that was filmed in an emergency room showing ER procedures and it showed an image of a patient chart with their name and address on it without consent. So the case law is not there yet, but it is likely to come with the numbers of people using social media. There was one case in Minnesota last year that went to an appellate court there where there was a case brought against the hospital for the claims that an individual employee had posted information. And this was a fact pattern that we've seen in other reported cases where an employee recognized someone who came into the clinic for an STD test, looked into their record, then posted that private information on a MySpace page. It was only viewed by a handful of people, and that employee was then terminated, but the patient brought the case against the hospital. And what was interesting in this particular case was that the court found that the private action could proceed under the state law for medical records, Minnesota Health Records Act, but ultimately did not find the hospital liable because what the employee did was not foreseeable within that employee's scope. But what was interesting was that it moved forward. It wasn't dismissed outright, and these types of cases, we may see more of them. They will be fact dependent and in many cases very dependent on state law. So some general tips on the privacy front is if you're communicating with patients, really should do so on a secure, HIPAA compliant platform or network. If you're doing a blog or other things, do it without patient identifiable information, unless you have a very specific and explicit consent, and even then, as an attorney, I would recommend against it. But just using patient information on public forums is very risky. How much information is too much information? You might not include patient name, but there have been cases and incidences where people have posted enough information that even though there was no name, it could be traced back to who the patient was. One example was a case, it wasn't a case, but it was an incident that was reported in Michigan where a technician treated both a police officer and a patient following a bank robbery, and then posted a Facebook post that said something along the lines of she had come to face with a cop killer and hoped he rotted in hell, or something along those lines. Well, people who knew her knew where she worked. The robbery and the reporting of it was somewhat public, so you could figure out who she was talking about. So and in these types of situations, employers and hospitals are starting to take very hard lines under their own policies, leaving aside whether it was a technical violation of HIPAA or not.